Our next item on the agenda, item 11, is our presentation of our Department of Health and Human Services annual update on our plan on aging. Welcome.
Thank you. Good morning, President Kinsey and members of the board. Great to see you this morning. Thanks for the warm-up. I think aging is fun also. We have some serious issues to talk about this morning, and I'm here with Amy Dietz, Pullen, Aging and Adult Services. Amy's our program coordinator, and we're going to condense 8 months of work into 5.5 minutes. We're formally here to ask for your approval of our state-mandated 4-year 2016-2020 area plan for aging. This plan, which will be incorporated into our larger Health and Human Services strategic planning efforts, was presented for public comment on April 7th at the San Rafael Community Center, and it includes the goals, priorities, and activities that we'll be undertaking in partnership with community organizations, stakeholders, and our Commission on Aging, several of whom are here in the audience this morning. As you know, as an area agency on aging, we are governed by the Federal Older Americans Act, and we have strict oversight by the California Department of Aging. The Federal Act provides funding for such services as home-delivered meals, caregiver respite and support, and a number of health and wellness programs. Most of these services are contracted out to community agencies, and those agencies, along with volunteer staff and their own fundraising efforts, help create this network of services and supports for Marin's older adults. Right now, looking over here at the chart, 1 in 4 of us is over the age of 60, and as we look into the next 15 years, you can see that we're going to be a much more older than younger county, when 1 in 3 of us will be over 60. To plan for this, in part, we conducted a needs assessment survey this past year of persons age 60 plus. The survey was widely distributed at community events, farmers markets, senior centers, faith-based organizations. We even had the Marin County Office of Education as a new partner joining us in getting this survey distributed. It asked about demographics, household composition, income, health, transportation, and 18 potential issues of concern. Our commissioners were very active in helping us get the word out and getting the survey distributed, and in conducting 2 public input forums back in January. So using this information from the survey and other data and the public input, we saw some themes emerge. And one of the more pronounced was the economic status of older adults here in Marin. Our survey reflects what previous data indicate, that while many are doing well economically, 20 to 25% are struggling to make ends meet and to pay for basics such as housing, food, and medication on a regular basis. This adversely affects them in a number of ways, including their reported health status, their access to caregiver services, and their nutrition risk. We all found it particularly poignant that among those struggling to make ends meet, almost half of them reported that they run out of money for food most months. This is why our network of food providers, food banks, community centers, other funders, and faith organizations will remain vital resources for us, and why collaboration, like what's happening with the Marin Women's Commission around economic security, why the collaborations will remain critically important. Our needs assessment revealed a lot of other relevant and interesting information, which you can find in the plan document. For instance, while economic status certainly creates disparities, we learned that there is actually much commonality among Marin's older adults when asked about their day-to-day concerns. We gave them a list of 18 potential issues or needs, and taken as a whole of the 3,000 people who responded to our survey, 3,000, those which rose to the top were the same across the economic spectrum. And they were concerns about falls and accidents at home, losing memory and cognition, financial security, crime and financial abuse, planning for end of life, and feeling isolated or depressed. So with our aim in aging and adult services that people are able to live well here in Marin, we'll be taking these issues along with the other data and survey information to guide our work objectives in this year and in the years ahead, and to shape our overarching goals for 2016-2020. Those goals are, first, we've heard that Marin's older adults want a good quality of life with attention paid to home, economic, and environmental safety and security issues. Second, we feel an imperative to continue to be in the role of supporting livable neighborhoods and communities like is happening with the Villages movement and the Age-Friendly Cities and Towns initiatives. We will continue to focus on making information about services and resources accessible and user-friendly. And fourth, we feel that we've been encouraged by the public to be open to innovative policies and programs through advocacy and community engagement. And we certainly like the community part. I've already mentioned how important collaborations are. We know those partnerships and grassroots efforts are really what makes the difference in making Marin an age-friendly place. To that end, there are a number of shared efforts already underway. Some I've mentioned, and the one I want to call out is in the middle. It's the Aging Action Initiative, which this board founded and funded and is now beginning its third year. We have over 60 organizations and at this point hundreds of people guided by a community-based steering committee who are expanding our aging services network, strengthening our aging services infrastructure, and addressing specific matters such as mental health, dementia, and care coordination. So there's much energy around this shared work. There's lots of enthusiasm out there in the community to work together, and people are enjoying the collective impact that we're having with this. The steering committee of the initiative has asked me to pass along that they would welcome the opportunity to report to this board at a later date on the initiative's accomplishments, progress, and plans. So we would like to do that. But for now, I want to thank our Commission on Aging, our staff, our community partners and volunteers, as well as our colleagues in Health and Human Services, especially the epidemiologists in public health who worked with us, and our media team who's been helping us get the word out about what we do. And of course, this board. Thank you for your support. Thank you for sharing in our vision that Marin's a place where people can live long and live well. Thank you. We welcome any questions or comments or direction you wish to offer.